End-of-life decision-making comes by its very nature at the worst possible time. It's a time of anxiety for the family, care for a loved one who is seriously ill and perhaps near death. This is the time when the physician often comes to the family and says, "We need your guidance in deciding whether or not to proceed with a particular procedure." During times like this, it's helpful to have principles in hand that can enable you to make solid decisions and the correct decisions for your loved ones. One of the principles that's most helpful in these kind of decisions is the distinction between ordinary and extraordinary means of treatment, sometimes called the difference between proportionate and disproportionate means of treatment. Simply put, extraordinary means are those that are difficult and may not be beneficial. Ordinary means are those that are easy to do and likely to be beneficial. Ordinary means are obligatory. We have a duty to preserve our lives. But the extraordinary are optional. We can pursue them if we want, but there's no obligation to do so. One of the first criterion is whether a procedure is likely to be successful. A procedure which is rarely done or experimental or in other ways difficult to carry out from a medical standpoint is by its very nature not obligatory. Again, one is free to try a means that are experimental or difficult, but it's not obligatory. Another key factor is whether the procedure is especially painful or would cause suffering. Long and difficult procedures typically fall into this category. Third category is the problem of psychological abhorrence. Some patients feel strong reactions at the very idea of certain procedures or operations. That again could be a sign that the procedure is extraordinary in character. So a procedure which is likely to be successful, which is not painful, which is not psychologically disturbing, and which is not expensive, those would all be ordinary procedures and obligatory. The distinction between the ordinary and the extraordinary is not a one-size-fits-all distinction. It depends on the patient.